It is news that works for your family's health this morning. Cases of whooping cough are at the highest level in a decade.
And it seems there are no signs of slowing down. In fact, the U.S. is returning to pre-pandemic patterns of whooping cough. The CDC reported cases are now 5 times higher than they were at this point last year. Now, this bacterial infection is called pertussis, but it's referred to as whooping cough because of the sound that people make during those coughing fits. There have been more than 14,000 cases reported so far this year, compared to a total of about 3,500 last year. With many cases going undetected, the spread of this bacterial infection can go unknowingly for weeks.
And that is why we want to bring in Dr. Frank Contessessa this morning to give us more insight, the information you at home need to know. Dr. Contessessa, thank you. So good to see you on this Wednesday morning.
Good morning. Great to be with you guys again.
Absolutely. Well, let's talk about why we're seeing this increase in cases this year. Does this have anything to do with the former pandemic, or is this something that's unique for other reasons?
No, it definitely has to do with the pandemic. People weren't circulating as much in public. There was mask wearing and people were just avoiding contact with others during the pandemic. So we're actually pretty close to where we were pre-pandemic. Obviously, it's a big rise over the last year or 2 or 3, but we're pretty close to where we were pre-pandemic.
Well, that's good to know, because we certainly don't want to scare people as we present the numbers. So at least we know we're on track with where we were before, even though it is uncomfortable to go through no matter what. So talk to us, Dr. Contessessa, about the best ways to possibly prevent whooping cough. Talk to us about the symptoms, especially for children. I remember when my son had it when he was young. It's a horrible sound and it scares parents.
That's right, Dominique. The things to remember here, most people are vaccinated for pertussis. It's when people get a tetanus booster, that's Tdap. So it's tetanus, diphtheria, and the P part is pertussis, as you mentioned. Babies get this at the age of 2 months. So they're pretty much protected before that. And anybody who's had a relative or a child who's had a child, the grandparents have to get boosters. And they say, oh, if you're going to be around the baby when they're an infant, you need to get a booster of the whooping cough vaccine. And it is very effective. The risk for infants is that they have no immunity towards it, and it really affects their airways to the point that 1/3 to 1/2 of infants who get pertussis have to be hospitalized, and a small amount can die. We lose 12 to 24 babies a year to whooping cough. So that's the reason that people have to be vaccinated when they're going to be around an infant. The symptoms early on look just like a regular cold, the coughing and sneezing and this and that. The whooping cough, that characteristic sound, doesn't come for a couple of weeks. So when people first get the disease, they don't know they have it. They just think they have a regular cold. The whooping cough comes later.
Well, that's interesting you bring that up, and you mentioned the vaccine. So in your opinion, who really needs this vaccine? I heard you talk about the elderly if they're going to be around infants, but are there also natural preventatives that people can consider if they don't want to take a vaccine?
And I totally understand that. There's a lot of, and that's the other reason that cases are on the rise, is the mistrust of public health that arose during the pandemic, because not everything was above board the whole time. People have mistrust of vaccines, and that's unfortunate, because traditional vaccines have been around for decades, and these vaccines have been around for decades. The skepticism that has arisen from the COVID vaccines is unfortunate, and it's a reason that people are seeking vaccines less. As from a natural prevention, it's keeping your immunity strong. So it's the same stuff we talked about with helping to prevent COVID and other, routine viral infections. So it's vitamin C, vitamin D, zinc, maintaining a healthy diet. As anything that you can do to keep your immune system boosted will help, because most people who get whooping cough, they're going to be fine. First of all, there's antibiotics to treat this. Really, a simple Z-Pak can be used to treat this. And you want to catch it early, because if you don't, that cough can persist literally for weeks to sometimes a month or 2 after the infection has cleared, even if you get treated with antibiotics.
Well, this is so helpful.
It's very helpful. And Dr. Contessessa, we want to say thank you for bringing out those natural remedies as well, because that's going to just help people stay healthy and increase our immune system across the board. So very important information. And we always, like you said, Dominique, we always want to mitigate panic and get people the actual facts here at Merit Street. So
Absolutely.
Dr. Contessessa, thank you. And thank you for wearing pink on this Wednesday morning.
We appreciate you so much.
Thanks for having me.
Yes, anytime.
Pleasure to be here.
Thank you.